Well, in most cases, people don't discover it until it's too late, and that's what's so scary about it.
It was really hard. It kind of felt like a death sentence to find out that I had pancreatic cancer.
As soon as you hear the word cancer, you think, oh, okay, normally treatable. When I heard it was pancreatic cancer, I spoke to my brother. He's a superintendent radiographer at Shrewsbury Hospital, and he's like, nah, that probably will be it.
So unfortunately, the statistics around pancreatic cancer are really stark. They tell us that this is one of the most deadly major cancers in the world, with only 12% of those people diagnosed surviving beyond 5 years. Unfortunately, that means pancreatic cancer patients are often the forgotten patients in New Zealand.
I think the key thing is to be really aware of some of the early signs and symptoms. The first most obvious thing was being diagnosed with diabetes, which was really odd. And then the second big thing was the dramatic weight loss. Another thing he experienced was real decrease in appetite as well. Another thing was the pain that he was experiencing, which sort of started in his abdomen and sort of moved around to the back. Despite the unfortunate stats around pancreatic cancer, it doesn't necessarily have to be terminal. And that is something that I've learned, because if it is caught early enough, there are options. Unfortunately, a lot of the early signs and symptoms are put down to other medical conditions.
I think that it's so hard to diagnose. Tiffany, my friend who had passed away previously, had said that her big regret was she didn't challenge what the doctors had said. They told her that she had reflux and she just said, okay, well, I've got reflux, but it didn't feel like that to her. And so she never sought a second opinion, and she believed that cost her life.
I used to call myself the forgotten patient because there's just so little information out there about pancreatic cancer. But the statistics that they keep throwing at you, and particularly the survival rate and the fact that it's growing so fast and people don't know what causes it, so they don't know what to tell their doctors about, it's just scary.
So this November, the Gut Cancer Foundation is shining a light on all the issues around pancreatic cancer. We want to make sure that Kiwis understand the risk factors involved, how they reduce their risk of developing pancreatic cancer, and how we can help with early detection by raising awareness of the symptoms. This November, we want to let New Zealanders know how they can help the Gut Cancer Foundation raise vital funds for new research and clinical trials to improve detection and treatment for pancreatic cancer patients in New Zealand.
So far things look good, but I know that with each scan they're never going to tell me at 100% with certainty that everything is fine, but I've just been able to go on with my life and as if I don't have cancer, and just sort of move on from it. And it's in the back of my mind, but I'm just trying to live life and enjoy it.
You know your own body, and so therefore ask questions, research. If you're not satisfied with the answers, get second opinions, but don't give up. Don't take anything for granted or anything as gospel from anybody.
There's 4 ways we're asking New Zealanders to show support this November. 1, we're looking for New Zealand landmarks to light it purple on November the 18th. Secondly, we're asking New Zealanders to host their own purple dinner, invite their friends and family and raise money for vital research into pancreatic cancer. Thirdly, we're asking New Zealanders to get involved in the first Pan-Can Gala, an amazing event being created by pancreatic cancer advocates in support of the Gut Cancer Foundation's research into pancreatic cancer. And fourthly, what we need New Zealanders to do this November is shine a light on the issues themselves. We need them to spread the word, share the social media posts that you will see going out, and make sure their friends, family and far now are aware of the symptoms and risks of this deadly disease.